What's going on, everyone? Happy Saturday to everyone. Hopefully everyone is doing well, staying safe, healthy. If you had taken a COVID test, hopefully you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long COVID issues. It is time now for the Saturday edition of the Pandemic Update for Saturday, August 3rd, 2024. If you're new to my channel, this is where I do the daily Pandemic Update on all things COVID, other viruses that could be a health threat to you, cases of illness, all kinds of different stuff to keep you informed and safe with what's going on. Because let's face it, COVID did not go away, didn't magically just disappear. COVID's still with us, and it is still a real threat. COVID still causes severe disease, long COVID, even a mild infection can lead to long COVID, and of course, people are still dying from COVID as well. Right now, we're in the middle of a summer surge. You need to be informed and know what's going on with this pandemic and other illnesses each and every day. That's what I do here on my channel. We do a video that's anywhere between 15 to 20 minutes each day. Today will probably be about a 18 to 19 minute video to inform you of what is going on. So if you're new here, welcome to my channel. Subscribe down below, give this a thumbs up, hit that notification bell, and of course share these videos with anyone you know, and leave your comments down below. Alrighty, today we do have a few news stories that we are going to talk about. Then we're going to take a look at some of our daily data. Then we are eventually going to take a look at emergency department visits for people diagnosed with COVID, where we're going to make several detours along the way. In other words, we're going to pause at many different states because I do have several different states pulled up. Some I don't think we've looked at for a very long time. Alright, starting off with this, I thought I would tell you about this. Aerosmith announces they're retiring from touring following Steven Tyler's vocal injury. That's right, his vocal injury is more serious than expected. Their farewell tour, it doesn't look like it's going to happen. It does say in here eventually he hopes to get back out again at some point, but at this point that does not look to be something that is going to happen, so that is not a good thing. Arkansas, COVID cases on the rise as August gets started, and it says here, Little Rock, Arkansas, COVID-19 is rearing its head again for many Arkansans, and cases are on the rise according to the Arkansas Department of Health. More than 200 people were hospitalized with COVID-19 in July. They said the number of cases has increased from May until now. So Arkansas, COVID cases are on the rise at this time. Now talking about long COVID, Bernie Sanders. Here we go once again. This is a good thing. Bernie Sanders says, for too long, millions of Americans suffering from long COVID have had their symptoms dismissed or ignored by the medical community, by the media, and by Congress. Unacceptable. Congress must act now. Yes, it is time for a long COVID moonshot. And he has introduced legislation, and it sounds like the Long COVID Research Moonshot Act of 2024 provides $1 billion in mandatory funding per year for 10 years to the National Institutes of Health, NIH, to support long COVID research, the urgent pursuit of treatments, and the expansion of care for patients across the country. That would be fantastic news if that were to happen. Now let's take a look at Mike Horger's weekly PMC COVID-19 forecast for August 2nd, 2024. Yesterday we did a look at the COVID levels from someone else. Today we take a look at one of the weekly forecasts that we look at each week. Remember, this is just a model, and his model, it can change. It's not necessarily going to happen the way his model shows, but it's just a projection of what may possibly happen as we head towards the end of summer. We're not at the end of summer yet, but as we head through the month of August, almost to near, we'll say, September, this is a projection of what may happen, and it may not precisely happen the way he shows it, but let's read what he's saying. Expect 2 more weeks of very high and stable transmission before the summer wave accelerates. Wait a second, accelerates? We've been talking about peaking here on the channel quite a bit, but this is what he's saying. Again, it's not what I'm expecting. It's not what I'm predicting. I'm just reading to you what he has posted on there because I'm just trying to give you an idea of what may potentially happen. Currently, at an estimated 850,000 daily infections, 1 in 56 Americans contagious. 43,000 resulting long COVID cases a day. So we just talked about long COVID, and here he's saying there could be 43,000 a day. Let's read some of his deep dive. We're not going to read all of it. Over the next 2 weeks, we should see very high and stable transmission before transmission increases rapidly. Note that transmission estimates are down marginally, of no practical impact relative to last week. One might be tempted to consider that the summer wave is subsiding. That might be a 5 to 10% probability. What's he getting at here? Well, we do know the KP 3.1.1 variant did just take over. I would have to think maybe that's some of what his model's seeing, but again, let's read on. This is where the model gets interesting. The forecasts are divided from a combination of recent patterns in transmission levels, change, rate of change, rate of range of change, as well as historical medians for that date. If only using recent patterns, a decline in the wave would be reasonable. However, he says, the historic data capture of all of that useful information on variation in human behavior, back to school, end of summer vacations, flights, Labor Day, that focusing only on recent patterns would miss because behavioral patterns also fuel viral evolution. These historical data also get to some extent at the idea of viral evolution of new variants, which we do not track directly in the model. So he's calling for, the potential, not calling for, but he's talking about how, when we have all this spread of COVID, it leads to the likelihood of there being a new variant. That's how we got to this variant soup to begin with. COVID goes on and on and on, generates cases, and as more people become infected, and as time goes on, well, more people being infected leads to potential for new mutations and new variants of COVID. Let's read a little more. When considering the forecast, view it two ways. One, based on current trends and historical data. That is what we would expect. Two, if human behavior defied historic trends, we could see something much different, such as a wave subsiding. If everyone were more cautious than average this year, or unfortunately something slightly worse than predicted due to the decline in public health guidance on mitigation. Here we go. This is what's important. According to the composite forecasting model, that means hovering between 700,000 and 1,050,000 infections a day over the next month. Transmission is very high, and we may reach a later summer peak of 1.1 to 1.3 million daily infections around September 11th. So he's saying end of summer vacations, Labor Day coming up soon, back to school. And it's not necessarily saying this, but I'll just add this in there. I would assume some of this is because we have a new variant that just literally took over. We'll have to see what happens. This could be a possibility of what happens, and I'll show you here. Taking a look here at the chart. Here is his chart. You can see it does kind of pause a little bit, which we are seeing right now. There is definitely a little bit of a national pause going on in some. Nationally, yes, it has slowed a little bit and has also rised in some areas. So we'll have to see what happens. And you can see his model does show it going up again at the end of the month. Whether that happens or not remains to be seen. But one thing that he does say at the end of this, and I think we need to read this: schools, medical facilities, and businesses should now escalate precautions and prepare for the disruption of a high percentage of the population getting sick through the remainder of 2024. Yes, even though it may peak on September 11th, it may peak in the next couple of weeks. Levels are not going back to spring. Levels are going to remain high for the rest of the year, and at some point in the fall, going into winter, we will see yet again another wave that will occur. So, yeah, levels are going to remain high for the rest of the year. Alrighty, moving on now to pollen levels, and we can see today's pollen levels, 39% of the country is in medium status, a lot of orange in the central region. Taking a look at air quality levels, not much I can really say about this. There are still bad air quality levels in the east, bad air quality levels in the west, and places in between. A little bit better in the east today, but we can see over the Great Lakes there's still problems. The Pacific Northwest, right on down through California, bad air qualities today for you. Heat-related illnesses continue to be a problem in many parts of the country as well. All right, speaking of heat-related illnesses and weather, I need to show you this. There is a tropical depression 4 that is currently over Cuba. It is going to impact portions of Florida and then the southeast coast. I know I have followers down this region. I have to have at least some down here because we are now, what, at 4,500 followers. So if this is you and you live in this area, please take this seriously. There is also potential it may hit hurricane status before landfall. And then, yes, what will become Tropical Storm Debbie is going to be very slow off the Georgia and Carolina Atlantic coast, and where it goes from there remains to be seen. Take this seriously. There's a lot of threats: wind, flooding, tornado threat, storm surge, all on the table. This is something we're going to be watching for the next week. I'll be tracking it over on my Climate Data Report Twitter page. You can see here I've already been tweeting about this, and hopefully more people go follow me over there because this is important stuff. You need to know what's going on. I just posted about the tornado threat a little bit ago, posted a whole bunch of stuff, and I will be on this account big time over the next week, probably almost more so than my COVID account because this is really serious. All right, getting back to health. Philadelphia, 866 EMS calls yesterday, and doing a live look into Montgomery County, Pennsylvania. Yeah, it's busy right now. 14 EMS calls reported there. All kinds of calls: cardiac emergency, nauseous vomiting, fall, fractures, seizures. Yes, a lot of different things going on there. And Chester County has been extremely busy this morning. Take a look at this. I'm seeing not one, not two, but 3 respiratory emergency calls. I'm seeing multiple diabetic emergency, heart problems, falls, back pains. There's just way too many calls in Chester County this morning. I was listening to Center County EMS this morning, and being August 3rd, a Saturday on August 3rd, students not back in, that's where Penn State University is. There were quite a few calls this morning, and I'll probably listen to them some more again this evening. Maybe I'll listen to Philadelphia as well. So things are busy right now. All right, let's take a look at what is going on with epidemic status in the United States. That is in the growing phase at this time across much of the southeast, stabilizing now in Florida and in the west coast. It's stabilizing in California now. That's a good thing. Starting to be likely declining across portions of Nevada and portions of Hawaii. Good to see there. Pennsylvania has temporarily stabilized here. Wouldn't surprise me if that goes up again because KP 3.1.1 did just take over in the United States. All right, moving on. Latest variant is the KP 3.1.1 variant, which is at 27.8%. KP.3 is at 20.1%. LB.1 is at 16%. KP.2.3 is at 14.2%. And then there's a lot of other variants. We are in variant soup. I don't know if KP 3.1.1 is going to ease some of this variant soup or eliminate some of it. We'll just have to wait and see. I mean, it did go up relatively quick, but KP.3 once did, KP.2, P2.3. Yep, there's been a lot of different variants over the course of this summer surge. All right, let's take a look at emergency department visits. I'm going to take this back up here to the beginning. United States. Nationally, things are rising for ER visits still. That really didn't pause this week. Alabama continues to rise for emergency department visits. That is up to 2% at this time. Alaska, take a look at this. You are starting to drop a little bit at this time. Arizona is dropping some at this time. Arkansas, we've already talked about you. Yeah, you're still rising for that. California, look at this. Signs of a peak for you. You may be starting to drop at this time. Colorado, a little bit of a sign of maybe a drop. We'll have to see what actually happens there. Connecticut continues to rise at this time. Delaware continues to rise as well. District of Columbia is dropping slightly. Then we come to Florida, which is starting to drop at this time, and this is where we take our first deep. And in Florida, we do see so far this year, they have had 301,248 cases. I don't know if that's actually updated. It says here, as of August 3rd, expect Florida to see some big data drops soon, and big increases in cases and deaths because they have had an issue for quite some time. I do believe their system was hacked or something like that, so that's not good. As for deaths, 3,030. Again, that could see a big increase in the near future because they did not report for quite some time, and plus, they are at such high levels at this point. Coming back here, Georgia continues to rise, Guam is dropping, Hawaii is dropping, Idaho is rising slightly, Illinois is rising, Indiana is rising, Iowa and Kansas still rising. Kentucky is almost at 3% now. That's not good. Louisiana is approaching 4%, and hopefully you're about to peak. Looks like it may be about to peak. Maine is starting to drop some. Maryland dropping some. Massachusetts is continuing to rise. Massachusetts is starting to report again, so we'll have to include that in a future update. Michigan's continuing to rise at this time. Mississippi, yeah, Mississippi, this is not good to see you going up as much as you are at this time. And I do believe I have Mississippi queued up here. Yes, take a look at this. We can see COVID-like illness is continuing to rise at this time. The number of cases is also continuing to rise. Yes, take a look at the chart here. Mississippi is in the middle of their summer surge at this time, and it does look like if they're going to be peaking soon, it will be slightly lower than last summer. Already moving on here. Again, Mississippi, look at that. Almost 4% for people diagnosed with COVID showing up at the emergency department. Montana is still trying to rise a little bit. It looks like it slowed off. Nebraska is rising slightly. Nevada is starting to drop some. New Hampshire is dropping some. Then we come to our next detour. New Jersey is up to 2%, and New Jersey for today does report 483 hospitalizations, 13 people on a ventilator, and in the ICU at this time. Can we show you that? 40 people in the ICU, and the discharges for New Jersey is at 87 at this time. New York is up to 2% or close to 2% for ER visits diagnosed with COVID. Can't show you New York's dashboard because, well, it's the same data from Thursday. It did not update yesterday. North Carolina, take a look at this. Wow, North Carolina is almost up to 3% at this point for emergency department visits. No signs of you slowing down either. That is not good. North Dakota is kind of slowly going up still. Ohio continues to rise. We know Ohio reported an increase in cases this week, so Ohio, I expect that's going to hit 2% soon. Oregon is starting to drop slightly. Pennsylvania continues to rise at this time. Rhode Island was slowing down. Now it's starting to rise once again. Remember, KP 3.1.1 did just take over. South Carolina, over 2%. That's not good. South Dakota is rising slightly. Tennessee continues to rise at this time, and I do believe that is our next detour. Let's see here. Yes, I do have Tennessee added here, and take a look at this. Cases. Looks like they may be starting to peak in Tennessee. Should that be the case, guess what that would mean? Your emergency department visits would probably slow down within the next week. Continuing on here, Texas continues to rise at this time. Hopefully Texas will be peaking relatively soon because you're getting close to 4% of emergency department visits being diagnosed with COVID. Utah starting to drop slightly. Vermont's still rising. Virginia is going up at this time. Washington has slowed down a little bit. It's trying to level off here. It's not really dropping just yet. West Virginia continues to rise. That is our next detour. And we can see here the indicators for COVID. They are going up here on both emergency department visits, which is now at 2%. And we can see here 2.02% of emergency department visits are for COVID. And for some reason, influenza. Hey, look at that. It is showing here that it's rising, and this did update on August 2nd, so that's not good to see. Wisconsin still rising. Wyoming, I think you have stopped reporting, so can't say much of anything for you. Alrighty guys, that does it for the Saturday edition of the Pandemic Update. We'll have another edition of the Pandemic Update again tomorrow, where we will talk about COVID and wastewater, and of course any news that pops up. Haven't done an update to the Olympics in a while. Not really much to report about it. Things have slowed down, or maybe they're trying to cover it up or stop reporting. I don't know. If you like this update, give it a thumbs up. Want to see more content like this? Subscribe down below. Hit that notification bell. Share this channel with anyone you know. And of course, remember to leave your comments down below. Thanks for watching. I will see you all again next time. Have a fantastic Saturday and stay safe, everyone.